Hi, this is Dr. Martinez. So now I'm going to go through a procedure called a sinus expansion. Okay, and I'm going to be using these two apparatus here. Okay, so simply here I have a part of what I use for my blood pressure cuff. Okay, so this is the bladder. Here I have a finger cot and a rubber band. I just use a rubber band, and here's a Q-tip to guide it. So what we're doing here is we'll have a patient who has a lot of issues with turbulence or breathing. And you may have a patient who has issues with retention of fluid in the sinuses, stuffiness, wheezing, and sometimes maybe they'll even have sleep apnea. So what I'm going to do is I'm going to actually help this man. He's been through this procedure at least 24 times with me because he's been a patient of mine for 4 years, and it's the only thing that works for him. So he sought me out by recommendation of a chiropractor. And so I see him once a month, and that takes care of the problem that he has. Okay, so once you come, follow me, and I'm going to show you how it's done. Okay, so come through my office. You can see there's my credentials there. Boy, come on back over here. We're going to walk through. So here's my adjusting rooms, and we're going to meet the patient who's given me permission to do the procedure. Hello. How you doing there, John? Okay.
Okay.
All right, John, so tell me what you're feeling right now.
Well, a little stuffiness in the left ear, and then some tension.
Tension. Okay. So obviously I'm going to adjust the TMJ, and I'm going to check and see where that's going on. So let's go and check for turbulence. Go and breathe. Okay then. Okay. Okay, other side. Okay, so we can hear turbulence, so we know that there's some restriction. So I'm going to go ahead and I took some KY jelly here just to kind of lubricate the nostrils. Okay, so I'm going to go ahead. Why don't you come on closer so you can actually see what I'm doing here. So really close. All right. So what we're doing is we're just going to go and direct the finger cot. Okay, where it needs to go. All right. Okay, take a deep breath in. Okay, and breathe out. And now that I got it where it needs to be, okay, I'm going to have him take a deep breath in and breathe out. Take a deep breath in. 2, 3, 4. You feel it there. Hold. Okay. Heard it pop. Release. Okay. Now go ahead and breathe. Okay. Come closer so they can actually see the nose. Okay. Breathe. Come on this side over my shoulder here. So it's a lot less turbulence. Good. Good. So we're going to go on the other side. We're going to do the same thing here. And the good thing about this is very, very non-invasive. We just go ahead and he's been through this several times, so he's really comfortable. So if it's a new patient, you want to explain what you're doing, and you probably want to take your time to not blow it up as hard. So I use typically 3 or 4 pumps, especially if they have large sinuses. If they have a smaller sinus passage, probably 1 or 2. You just have to be able to feel for it. Okay. So it's right up where I want it to be. So take a deep breath in and breathe out. Breathe in. Okay. Pop. Okay. Release. Okay, good. Breathe. Okay. Much more clear. Here. Okay. How does that feel now? Feel a lot better? Okay, good. Okay, well, thank you so much for viewing, and if you have any further questions, just go ahead and call the office. This is Dr. Martinez at ADIO Chiropractic. You can reach us at 671-637-8901 or ADIO Guam at yahoo.com. Thank you so much, and have a great day.